So you do not just regular kind of dermatology, of course you do aesthetics as well, but dermatopathology. I think a lot of people don't know what that means, or,
Yeah.
why is a dermatologist doing something that a pathologist might do? So if you can just elaborate on that.
Yeah, totally, man. Good question. So dermatopathology is basically the study of skin under the microscope. So basically when if you were to go to a dermatologist and have a biopsy performed, whether it be of a rash or of like a lesion, like a mole or something that could potentially be a skin cancer, I'm the guy who looks at it under the microscope and renders a very specific diagnosis, whether something is cancer or not, or what type of specific rash that it is. It's pretty much like the nerdiest part of dermatology. Most dermatology residents absolutely hate it. Like it's just, it's not the favorite subject for most dermatologists, but for some reason I always loved it. I always knew I wanted to do it. It's a lot of fun. I think, for me as a dermatologist, as a clinical dermatologist, it's kind of cool doing both sides of it. You're kind of looking at the patient from the outside in and also looking at their skin from the inside out. For me personally, it makes me a better dermatologist. I'm kind of like dermatologists that other dermatologists refer their patients to just because of that skill that I have. And
Right.
it's
Was
fun. So
that, oh, sorry. Go ahead, sorry.
oh, sorry. Yeah. So it's actually a huge part of my practice. Probably 50% of what I do is dermatopathology. I read slides for other doctors, plastic surgeons, dermatologists, even some
Yeah, for
oculoplastic
me.
surgeons in the city, and yeah, and for Gary,
Yeah,
yeah. And I love it. I have a full service lab where we process all the
yeah,
specimens. You were asking if it's additional training. Yes. So
yeah.
DermPath is a fellowship after dermatology. So
Okay.
I'm board certified in both. I'm board certified in dermatology,
Wow.
which is the clinical side of things, and I'm board
Yeah.
certified in dermatopathology. A lot of folks do that from pathology residency, like you mentioned, and a handful of us from dermatology do it. And you also mentioned, why would a dermatologist do it? Well, for the reason why I explained, but also for dermatologists
Hmm.
that are actually seeing patients, sometimes it's preferable to have a dermatopathologist who's been dermatology trained reading your specimens, because they can help with treatment. So a lot of like the docs who sent to me, I can tell them, hey, so if my patient had this is what I would do to treat them,
Hmm.
because I'm on both sides of the coin.
Yeah.
And a lot of dermatologists find that very helpful.
Yeah, it was such an interesting experience for me because I remember asking you, I think, a question about like some skin lesion. You're like, oh, well, just send those to me. I can read the slides for you. And I didn't realize that
Yeah,
was an option. So used to sending it to like LabCorp and Quest, these big names that you hear of.
right.
And the experience was so different. First of all, because I could send you the clinical photo and I
Yeah,
can say, this is what I'm seeing. And then you can kind of put the two together. Also, like the actual report comes back super fast
yeah,
because it usually takes you a couple days. You can get it same day since we're in the same city. And
yeah.
then I guess you're reading them throughout the week. So the result, and you just kind of email me. So it just comes right back. Whereas with the other companies, what I was finding is not only would it take at least a week, but then a lot of times they're sending it out to like, I don't know, Harvard or some other place
Hmm.
because they don't maybe have like a dermatopathologist with your expertise, in that lab. So then you're
Yeah.
waiting for weeks and you still don't have a result and patients get annoyed.
Totally. So for me, what I offer, like the other docs, it's a very boutique service. So, all the docs can text me. I can give you a verbal, usually the next day. It's kind of like, if you get your suit from like Tom Ford, or you go to Men's Warehouse, So
Yeah. Yeah.
I'm the Tom Ford of dermatopathology.
Yeah, it was like an unreal experience. I keep trying to relay that like amazingness to my patients, and they don't quite always get it right because if it's like the first thing that they had removed, like they don't know how long it usually takes, and
Right.
to them it's not, I guess, a big deal. But I can appreciate the value that you bring
Yeah, you're
in
kind of
that.
like a doctor's doctor when you're a pathologist. Like, pay from the patient side of things, they have no idea it's a lab. A lab is a lab.
Yeah.
But, for a doctor, I think it's a special service. And I really pride myself on like what I'm able to do for my docs that sent to me. I
No,
really,
I think it's
you know,
really important to bring that out because I mean, like you post so many different things on your social, and it's all like really, really interesting. I'm sure you've posted something about the lab stuff, but I think it's easy for people to lose sight of that, and they just kind of see you as the clinical dermatologist with the social fund, but they forget this is like a lot of what you do, and it's like a
yeah,
really impressive skill. So
I
very
appreciate
cool.
it, man.